Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor?
I was at a lecture a couple of years ago, performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself, you couldn't make it up. She walked into the room, saw her own scans with the doctor, and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot.
What's her name and her book?
It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, e.g. labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing.
Internet high five from an oncology patient. Thanks for doing what you do. I don't get involved in the management. I let the doctor seeing me lead that, unless they missed something huge, and I would just double check. The main difference is I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Fastest consultations ever. Very methodical.
And GT, the main difference is I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Oh man, I'd like to be able to do that. I have a pretty extensive medical history, and with new MDs, I go in with a type up, but I'd love to have an elevator pitch down. I think it takes me about 2 to 3 minutes currently.
Doctor here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do I usually just STFU, especially if it's a field of medicine I have no idea about, like say, derm. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better then we can do ABC.
Real question is, do you understand the prescription the other doctor writes?
Just wanted to say thank you for one of the more original Ask Reddit questions I've seen in quite a while. Really interesting subject.
The pace and density of the conversations is different, I'm sure. I'm an emergency physician who has over time treated various physicians in my community, including internists, surgeons, radiation oncologists, some from my hospital and some not. Keep in mind that each specialty is quite different from the others. The rad-onc, for example, thinks and speaks differently than the orthosurgeon, and I felt like my treatment of each of them was really quite similar to treating a professor of engineering. Academically minded people tend to ask lots of questions and research stuff while you're out of the room, as compared to populations that request a more paternalistic bent and just want you to tell them what to do so they can get on with their day. I'm careful to credit that the number of hours that went into my family physician's training are the same as mine, simply a different topic. She knows tons of stuff about management and screening for chronic disease that I don't, and I know how to intubate people, manage a bad LSD trip, or use a jar of bubbles to distinguish between kids that are scared and kids that are head injured.
My mom's a GP and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For stuff like getting ultrasounds, etc., then yes, they do discuss stuff like it's a group project.
How was it growing up for you? Did she get over every little ache and pain, or were you just told to walk it off because she's seen so much worse? Asking because I know experiences from both sides. I hope you get some doctors in here to give personal answers. Paul Kalanithi did address this a bit in his book When Breath Becomes Air. At first, in his cancer treatment, he was very involved in the decision-making, and the way he described the conversation with his oncologist was more like a collaboration. Later, she reminded him that he didn't have to participate in the decision-making and that he could just let her be the doctor and focus on himself. He ended up taking her up on this offer. So even between the same patient and doctor, the relationship varied.
One of the best books I've ever read.
I'm an doctor, and sometimes I have other doctors as patients. For the most part, they're pretty good patients because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk where I simplify medical terms for lay people. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand, and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, my aunt is a nurse, and she said I need a whole body MRI for this runny nose. As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else.
As a veterinarian, many of my worst clients are nurses and doctors. Lots of questionable home diagnoses and treatments. Yeah, people and animals are pretty close, but we're not the same and medicines don't work 100% the same. I agree about having difficulty dialing back the patient talk though. These are folks that can understand medical terms, and I don't want to be demeaning, but I've got my dumbed down spiel about things and it just flows out. To be fair, I recognize that I'm probably annoying to my doctor too. Although when I went in for surgery last year, I had a great time chatting with the anesthesia nurses about protocols until they drugged me.
Doctor here, family medicine. I self-diagnose most things, but for my 1-year-old daughter I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since on myself. If I go to a doctor, say a gynecologist for a routine checkup, I sometimes just don't say what I do so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions, as in debating questions and giving me options that he wouldn't necessarily do with the patients. BC he can be sure I understand the medical pros and cons well once I'm given a basic explanation.
Very smart choice. We had a family doctor who was very good and very knowledgeable. But he took for granted some symptoms because he was scared when treating his 7-year-old son, and the kid died of meningitis. It took him years before he got the courage again to treat patients, and in the beginning he had brought in a fellow colleague of his to be present for consultation. He was so shook up.
Dr. here, it is a bit dependent on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist, I certainly wouldn't be chipping in. For more generic conditions, I have previously offered my thoughts to my doctor about what it could be. Ultimately, I still go to the doctor, as they can prescribe drugs/order tests for me that would be difficult/questionable for me to do myself.
Your answer seems to be the most genuine and reasonable answer yet, Ty.
Doctor here. In general, we are not good about going to the doctor. For me, it's physicals about half as often as recommended, and that time I had strep a year and a half ago that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately I am going to defer to someone with more expertise than me in that area who can make an objective decision.
When I go to the doctors, it's also like a group project. I let everyone else do the work and reap the benefits. I was sat in a consultation between 2 doctors, with one needing an ultrasound. They knew each other through work already, so it was very friendly and casual between the both of them. The patient doctor trying to figure out what was going on the ultrasound screen, and the doctor was teaching him the bits he didn't know.
My dad's a doctor, and he said he'd stay up till 2 or 3 a.m. discussing med school topics with his roommate, sorta for fun, and also for the obvious benefit. I always go to someone who don't know me, and I wouldn't say that I'm a doctor as well. On the other hand, my so is a doctor too, and whenever we feel something we do discuss it like a group project in which he always refused any treatment until his symptoms got to the very worst.
First of all, love the username. For some reason your comment reminded me of something that happened with my ex-husband. He's critical care/anesthesia. My ex, an accomplished drinker, went in for a routine checkup with a doc he didn't know. Doc asked all the standard questions, including, how many drinks do you have a day? My ex made up some lowish number that he thought would be appropriate. The doctor said, "Oh, that's a lot, you should have lied." My ex said, "I did lie. Did I not shoot low enough?" Both my parents are doctors, and they see each other as their doctors. For their situation, they don't make appointments for anything, so if I or they get like the flu, they just write a prescription. If they need specialists, they usually tell them they are doctors, and they get better treatment, like skipping lines or whatever, or they know each other already, so it's chill. I'm sorry this kinda sounds spoiled, but it's my experience.
Sounds awkward. Looks like you picked up an STD. I prescribe a divorce.
Greatest doctor call of all time. First, paramedic here, not doctor. Call for chest pain, side of the road. Guy pulled over to call 911, not local, just passing through. While my basic is slapping leads on getting some history, guy is obviously well educated, knows his stuff and just speaks the lingo. I run a 12 lead, it's bad. Not end of days, just hey let's get the cath lab wound up and drive really fast. It's also a little odd. So I decide to flip it, 15 lead, flip it again, do a right side. Whole time we are making tracks to the ER. Guy asks about nitro and I start explaining that certain types of heart attacks can be made much worse with nitro. He asks to see his strips. Humor him, hand them over while I'm calling in my report. He thanks me, say I'm right, it's anterior etc., and he's going to need XYZ bypass etc. Freaking cardiologist. Coolest, most laid back point ever. Having a freaking heart attack, and starts explaining to me about the surgical process he's about to be under.